Lucentis is indicated for the treatment of patients with neovascular, also known as wet, age-related macular degeneration. Lucentis is contraindicated in patients with ocular or paraocular infections. Intravitreal injections, including those with Lucentis, have been associated with endophthalmitis and retinal detachment. Increases in intraocular pressure have been noted within 60 minutes of intravitreal injection. Serious adverse events included endophthalmitis and, rarely, events related to the injection procedure, such as rhegmatogenous retinal detachment and iatrogenic traumatic cataract. Please see the Lucentis full prescribing information. Introducing Lucentis, a breakthrough in neovascular AMD. Seeing is believing. Although neovascular age-related macular degeneration, or AMD, accounts for less than 10% of all AMD cases, it causes about 90% of all AMD-related cases of legal blindness. Neovascular AMD can progress quickly, with vision declining to the equivalent of legal blindness in one eye in as little as 2 years. Previously approved therapies for neovascular AMD have been shown in clinical trials to slow vision loss. Now, for the first time in neovascular AMD, Lucentis offers patients the potential to regain vision lost to the disease. Lucentis has been shown to maintain or improve vision in patients with neovascular AMD for up to 2 years. Lucentis provides efficacy by targeting the pathophysiology of neovascular AMD. Let's take a closer look at a healthy eye before the onset of neovascular AMD. As we enter the eye, we see the periphery and the central retina, the optic disc, the macula, and the fovea. This is the cross-section of a healthy retina. In contrast, neovascular AMD disrupts the anatomy of the retina, leading to central vision loss. Neovascular AMD is characterized by angiogenesis, the localized proliferation of highly permeable choroidal vessels, caused by an overexpression of the growth factor known as VEGF-A. In vitro studies, VEGF-A has been shown to be a primary factor responsible for the development of choroidal neovascularization in neovascular AMD. However, there are several types of growth factors: VEGF-A, B, C, D, and E, and placenta growth factor, that are essential to many processes in the body, including wound healing. There are several biologically active forms of VEGF-A that differ by amino acid length: VEGF-A 189, 121, 165, 206, and the cleavage product VEGF-A 110. These forms all promote new vessel growth and vascular leakage. In the presence of plasmin, a component of blood, cleavage occurs and all VEGF-A forms are converted to VEGF-A 110. Therefore, leakage associated with neovascular AMD may increase the amount of VEGF-A 110 cleavage product. When any of these VEGF-A forms bind to their receptors on nearby choroidal blood vessels, highly permeable new blood vessels grow into the subretinal space, causing edema and damage to photoreceptors, ultimately leading to central vision loss. Over time, formation of fibrous tissue and scarring may also occur, causing permanent macular distortion and central visual field defects. Seeing is believing. Lucentis is a breakthrough that is changing the treatment landscape for neovascular AMD. Lucentis is an antibody fragment formulated for ophthalmic use that was designed to quickly and completely penetrate all layers of the retina to reach the site of choroidal neovascularization. Unlike other therapies, Lucentis was designed to bind with high affinity to all known forms of VEGF-A, including the biologically active cleavage product VEGF-A 110. This binding prevents the interaction of VEGF-A with its receptors on the vascular endothelium, reduces vascular proliferation and permeability, and decreases macular edema. See the evidence. Lucentis is FDA approved to treat neovascular AMD based on the results of 2 pivotal Phase 3 trials, MARINA and ANCHOR. In the MARINA trial in patients with minimally classic or occult lesions, 95% of Lucentis-treated patients maintained vision at year 1 with monthly dosing versus 62% sham, and 90% maintained vision at year 2 versus 53% sham. And in the ANCHOR trial in patients with predominantly classic lesions, 96% of patients treated monthly with Lucentis maintained vision versus 64% of verteporfin PDT-treated patients at year 1. See the letters. In the MARINA trial, with monthly dosing, 69% of Lucentis-treated patients experienced a gain of more than 0 letters on the ETDRS eye chart at year 2 versus 22% sham. In fact, with monthly dosing, Lucentis improved vision by at least 15 letters in 33% of patients at year 2 versus 4% sham. Lucentis resulted in a mean improvement in vision of 22 letters versus the sham treatment at year 2. Similarly, in the ANCHOR trial, with monthly dosing, 75% of Lucentis-treated patients experienced a gain of more than 0 letters at year 1 versus 28% of verteporfin PDT-treated patients. In fact, with monthly dosing, Lucentis improved vision by at least 15 letters in 40% of patients at year 1 versus 6% of verteporfin PDT-treated patients. Lucentis resulted in a mean improvement in vision of 21 letters versus verteporfin PDT at year 1. See the safety profile. The safety and tolerability profile of Lucentis has been established in more than 1,000 patients for up to 2 years. And because it is an antibody fragment, Lucentis achieves rapid systemic elimination, minimizing systemic effects. Seeing is believing. Lucentis redefines efficacy in neovascular AMD for a difference that your patients can see and that you can see in your patients.